Did you see a lot of pink this month? It is everywhere because every October, all kinds of products sport a pink ribbon to bring attention, breast cancer. Now, all that attention means more women than ever are getting those mammograms. For women over 50, there's little dispute that breast cancer screening does save lives. But the journal Lancet reports this week there's a cost that for every life saved because of a mammogram, 3 women undergo unnecessary breast cancer treatment. What does that mean? Because nobody wants unnecessary treatment. All right, here to explain breast cancer, surgeon Dr. Deanna Attai from the Center for Breast Care in Burbank. Let me just get your take on this study, because you're not surprised.
I'm not necessarily surprised. There's no question that there are certain cancers that we detect that are very slow growing, that will never impact a woman's overall survival. The problem is we can't always tell when we diagnose somebody, is their cancer the type that really needs to be treated or not?
So a woman goes in, she's diagnosed with breast cancer,
Right.
and you just can't tell her what's going to be the outcome.
We have more information now than we ever have in terms of the biology of the cancer. What's the inner workings of the cancer cell? So we can give a better idea of how aggressive this is, how do we recommend treating you. But what I can't truly say for the woman who has seemingly not aggressive disease, I can't tell her you're okay without treatment.
Well, we know in this country alone, 40,000 women a year die of breast cancer.
Correct.
But not all breast cancers are fatal, because 200,000 women are diagnosed a year, right?
That's correct. That's correct. But again, even in women that sometimes have relatively indolent disease that doesn't seem very aggressive, some of them go on to develop metastatic disease several years later and will then die from their breast cancer. We haven't gotten to the point yet where we can truly say to an individual patient, your breast cancer, don't worry about it.
Yeah. Well, unnecessary treatment, nobody wants to go through that.
Correct.
It's harsh on the body.
Right.
There are long-lasting effects.
Absolutely. From surgery, there's potential complications like lymphedema and other problems. Obviously, chemotherapy can have long-lasting effects on the body. So we try and balance our wanting to diagnose early, because we don't want to go back.
Yeah, you want to get that diagnosis early.
We don't want to go back to the 1950s where
Right.
women were diagnosed with very advanced breast cancers. This was before screening mammography.
And then the treatment is that much more harsh.
Correct, correct. But what we also have done in developing such sensitive screening techniques is we've picked up a lot of very tiny cancers. Not all of them need to be found.
So it's just a reality of what you do. I mean, we saw this with prostate cancer as well,
Right,
that
right.
some diagnosis, you're just not going to know the outcome. But are you finding women who do get treated are glad they got treated?
The majority of women that I see in my practice and that most of us see in our practices are glad that they were diagnosed in early stages, and they are glad that they were treated. Because none of us have a crystal ball,
Yeah.
no patient wants to be the one that 5 years down the line said, I wish I had gotten treated.
And so you're saying get that mammogram, and if you are
Correct.
diagnosed, get treated.
Correct.
Dr. Attai, thank you very much.
My pleasure.
Okay, Jeff, send it back to you.
All right.